And I want to thank Sinn Féin for the motion tonight. And frankly, Minister, I think we're all in a little bit of shock in relation to recruitment embargo in relation to the health service. Rather than going into a state of contraction in relation to recruitment and in relation to need, where we should be expanding, and everybody would agree with that, because obviously this is going to have a detrimental effect on our health services, and those fault lines that were very visible, particularly around COVID, between private and public, them fault lines will be more exacerbated because of the inequalities and the historical inequalities that we have in our Irish health system. Just give one example. In Dublin Midwest, and this is the ludicrous situation that mothers and that find themselves in. For the last couple of years, there hasn't been access to public health nurses, particularly in Lucan or Newcastle. And obviously, these are quite expanding areas in relation to the services that they need. And there is no public health nurses for small children. Now, that sends alarm bells straight away, where a child doesn't have access to a developmental nurse in relation to their healthcare, and that's been going on for the last couple of years. And obviously, the embargo now is going to stop that process. So that is extremely worrying, and we're in a situation where there's a huge deficit in relation to the health system, and now the health system needs a bailout. So it's not in great shape, Minister. And look, I come from a point of view where we should look at the positives of our health system, and there's a lot of positives, a huge amount of positives, but there's also a huge amount of deficits, and they're real, and they're not made up by the opposition by any means. These are historical. These are where people that need access to healthcare can't get it because they don't have private health insurance. And I think it's a ludicrous situation where 50% of the population rely on private health insurance. That's not a sustainable model in relation to healthcare and the model of universal healthcare. Where Sláinte Care is trying to strive for that, and that's a good model. But I think we're far a distance from a universal healthcare system in relation to providing healthcare. So, Minister, I think it's, as I said, it's deeply upsetting, it's deeply troubling in relation to the recruitment embargo, and it will have a knock-on effect. There's no doubt about that in relation to professionals in the health services and professionals that want to come into the health service, because when they see that Ireland at this moment in time is not employing particular professions, that can have a knock-on effect, and they will not come to our health service, which we need. Ireland, like most healthcare systems, is a very multicultural system of people that are in it. If you want to see one profession, in anywhere in the world, Ireland's no different. It's hugely multicultural. There's a huge amount of nationalities, a huge amount of motivated people that want to, do their best for their fellow human beings. So I think this, Minister, is a retrograde step in relation to our overall health system that wants to have a system of more equality rather than inequality. And I just think it's a bad step backwards, and hopefully it can be amended very soon. Thank you.